It is 4 minutes past 5. A twice-a-day pill for the most common type of advanced breast cancer has been approved on the NHS. Potentially up to 3,000 women every year could benefit from the targeted drug, capivasertib, made by AstraZeneca, which helps to slow or stop the spread of cancer cells. The drug aims to extend the life of people who are in those advanced stages of breast cancer. Here's our health reporter, Sophie Hutchinson.
Capivasertib is considered groundbreaking for some women with advanced breast cancer. It was designed to combat the most common type of the disease, known as HR positive, with a particular gene mutation. Trials have shown the drug shrinks tumours in 23% of women and doubles the time treatments remain effective, from months to even years of better health. It targets a growth protein called AKT in cancer cells and switches it off. One benefit is that, unlike chemotherapy, this drug has few side effects. It's hoped around 3,000 women a year in England will now benefit from capivasertib on the NHS.
Local GP Dr. Rachel Ward says this is good news and has been chatting to our presenter, Phil Mercer.
Any cancer treatment which is, giving people longer with advanced breast cancer in this case is always good news. And I think there is some incredible research going on in the UK. This is a UK developed drug. And it's great to see that it has been approved by NICE. And now we want to see things, go through quickly so women can access it.
And that's the thing, it's getting access fast enough. And I mean, Sophie mentioned it a little bit there in her piece, didn't she? The fact that this is for the most advanced stages of breast cancer, really, where things are getting quite bleak by that stage.
Yeah, so this is for people whose breast cancer has spread to other parts of the bodies, but it is attacking a different genetic mutation, and it does have good evidence that it stops the cancer from spreading further for an amount of time. Of course, unfortunately, it doesn't cure the cancer, but we are in an age now where there are still many treatments which we are using, and we're still finding new treatments for advanced breast cancer. And actually, the survival time for people with breast cancer that has spread has dramatically increased over the last decade or so.
And I mean, we have talked about this a lot over the years, haven't we, Rachel? But it's like the earlier that you get that diagnosis, the better. Are we getting better at that bit?
Yeah, so with actually every cancer, the sooner you pick up the cancer, the better the outcomes. And I think we are getting good. We're certainly much better at talking about abnormalities in the breasts and checking, doing regular checks on ourselves. I think there's always going to be that niggle in the back of your mind that, you find something and you think, I'll just put that off for a bit. I'm sure it's absolutely fine. But it is, first, two things, incredibly important that if you find an abnormality, so whether that is a lump, whether that is a difference in the appearance of your breast, that might be the skin or some dimpling or some redness or a change in the position or the appearance of the nipple or bleeding from the nipple, you just get it checked out. Because actually, lots of women come to see us and say, I think I've got a problem, and we check them over and say, actually, no, I think we're fine, or we'll see you again in a couple of weeks. That is not a problem. We're very happy to do that. But the other thing is, as soon as you are invited for breast screening, and that starts for most people age 50, just go along, just book it.
That is Dr. Rachel Ward. And Dalia Ismail is a breast cancer survivor from our area and joins me now. Hi, Dalia.
Hi, Katie.
Thank you so much for coming on. Can you tell us a little bit about your own experience of having breast cancer?
Yes, sure. I was diagnosed with breast cancer in 2022, so 3 years ago now. I underwent a year of active treatments, including chemotherapy and radiotherapy. I had several surgeries, and I still remain on monthly injections, daily tablets, and anti-cancer infusions to help reduce my risk of getting stage 4 breast cancer. The type of breast cancer that this drug is going to help, where it spreads to another part of the body and becomes treatable but not curable. So I had a hormone receptive cancer, and hopefully on my current treatment plan, I'm considered cured. But however, after having cancer, no one really knows who's going to be the ones to progress to stage 4. So I am on quite a lot of quite intensive treatment still to, give myself the maximum chance of that not being a possibility.
How intensive is that treatment that you have to undergo now, if you don't mind me asking?
It's a lot to manage day to day. I'm definitely getting more in the swing of things. To start with, it was very, very hard. It had a massive impact on all areas of my life. I struggled to go back to work, which I have done now, but it's been more recently. The kind of fatigue that I quite often deal with can sometimes be quite debilitating. Because I'm on drugs that put me in a treatment-induced menopause, I have to deal with all of those menopausal side effects. And because I was relatively young, and many young women are in this situation after they've had a breast cancer diagnosis, you have all your hormones reduced down to nothing. So in a natural menopause, a woman would gradually have reduced levels of hormones, and then they would still have some hormones made by their brain, by fat cells. However, in my situation, I had a car crash menopause that took me from my kind of normal levels of someone in their early 30s to the menopausal levels. And then additionally, the tablets I take kind of mop up the rest of the estrogen that I would have ordinarily in my body if I'd gone through a natural menopause. So It's dealing with an almost very extreme type of menopause at an early age, which brings with it lots of side effects such as joint issues and cognitive various cognitive issues and hot flushes, all of those kind of general symptoms that you hear about with a menopause. But it can be quite intense and very hard hitting when it's done kind of in the space of one injection.
Yeah, oh my goodness, so much to deal with. Dalia, the twice-a-day pill that we're talking about today that's been in the news for the most common type of advanced breast cancer, I know this isn't what you're affected by personally, but how do you feel hearing this news today?
I think it's brilliant news. I think any other cancer drug that can be approved on the NHS, that women or people, men included, can access this if they have this kind of secondary breast cancer, is really, really good, especially one that can extend life expectancy for, I think it's up to an extra 4 months in those with that kind of breast cancer, and something that acts in a more targeted way. So I've had chemotherapy and I know how tough it is to undergo chemotherapy. But if you have stage 4 breast cancer, you could end up on chemotherapy with no immediate end date, and having to manage those side effects can really impact quality of life. So I really hope that this drug can be slightly softer on women rather than the kind of all guns blazing effect that chemotherapy has. It's more targeted. So from my point of view, anything that can help those that are in this situation to help extend that precious life and give them more opportunity for hopefully more drugs to be available, I think is brilliant news.
Yeah. And we heard Phil and Rachel talking about the importance of picking up symptoms early. What is your message to people listening?
So I heard the doctor mention about all the signs and symptoms of breast cancer, which is really important, and going for screening if you're of screening age. I wasn't of screening age, so I would really like to highlight for younger people going and getting checked if they have something unusual. I was outside of the screening age by 17, 18 years, so I would never have found that on a screening mammogram. And actually, they're not particularly effective on younger women. So my message to younger people is to really go and check, because we miss that screening age, so we really have to go with a sign or symptom to get checked for signs of cancer, and that can be really important because that often results in younger people getting diagnosed later, and therefore the treatment options can be more intensive. And also you can end up having less good outcomes compared to someone who is maybe older, who has gone for a screening and has had that picked up at an earlier stage. So for me, it's really to all of the younger people out there as well to be really mindful of their bodies and not assume that you're too young.
Yeah, what is normal for you, to be aware of that. Dalia, thank you so much. Really appreciate you joining us this afternoon. That is Dalia Ismail. It's coming up to you 5:15.
Katie Tyler. BBC